Finding a safe haven. Tips for choosing the best care home for a loved one with dementia. Finding quality care for loved ones with dementia can be a difficult and emotional decision. You want to ensure that they receive the best care possible, but it can be tough to navigate the many options available. It's essential to choose the right care home that will provide a safe and comfortable environment for your loved one. In this post, we'll be sharing some valuable tips to help you choose the best care home for your loved one with dementia. From understanding the different types of care homes available to considering location, safety, and staff training, we'll cover all the essential aspects to help you make the right decision. With these tips, you can ensure that your loved one is in the best possible care, and you can have peace of mind knowing that they are comfortable and well cared for. 1. Introduction. Dementia and care homes. Dementia is a condition that can cause a wide range of symptoms, from memory loss to difficulty with speech and mobility. As the condition progresses, it can become increasingly challenging for family members to provide the care and support that their loved one needs. In such cases, a care home can provide a safe haven where individuals with dementia can receive the care and support that they require. Care homes are specially designed to cater to the unique needs of individuals with dementia, providing a range of services that can help to promote their well-being and quality of life. Choosing the right care home for a loved one with dementia can be a daunting task, however, as there are many factors to consider. From the location and facilities to the level of care and support provided, there are many different aspects to think about in order to ensure that your loved one receives the best possible care. In this blog post, we'll provide some tips and advice on how to choose the best care home for your loved one with dementia, helping to ensure that they receive the care and support that they need to live their lives as fully and independently as possible. 2. Understanding the different types of care homes available. When it comes to finding a safe haven for a loved one with dementia, it's important to understand the different types of care homes available. The most common types of care homes are nursing homes, residential homes, and dementia-specific care homes. Nursing homes are designed for those who require 24-hour nursing care, which means they have qualified nurses on staff to provide medical care for residents. Residential homes, on the other hand, are for those who require assistance with daily living activities such as bathing, dressing, and eating. These homes do not have qualified nurses on staff but do have caregivers who can provide basic medical care. Dementia-specific care homes are designed specifically for those with dementia and provide specialized care for their needs. These homes have staff members who are trained in dementia care and can provide a safe and secure environment for those with the condition. It's important to carefully consider the needs of your loved one with dementia and choose a care home that can provide the appropriate level of care. Visiting the care home, meeting staff members, and talking to other families with loved ones in the home can also give you a sense of whether it's the right fit for your loved one. 3. Choosing the right type of care home for your loved one's needs. Choosing the right type of care home for your loved one's needs can be a daunting task, but it doesn't have to be. The first step is to assess your loved one's needs and determine what type of care they require. Some care homes specialize in providing care for those with dementia, while others offer a variety of services for those with different needs. If your loved one has early-stage dementia, they may not require as much medical attention as someone in the later stages. In this case, a care home that provides more social activities and less medical care may be a better fit. However, if your loved one requires more medical attention, you may want to consider a care home that has a higher staff-to-patient ratio and specializes in dementia care. It's also important to consider the location of the care home. Ideally, you want to choose a care home that is close to friends and family so that they can easily visit. Additionally, you may want to consider the environment of the care home. Does it have a warm and welcoming atmosphere? Are the residents engaged in activities and interacting with each other? These are all important factors to consider when choosing a care home. Overall, the key is to find a care home that meets your loved one's needs and provides them with a safe and comfortable environment where they can thrive. 4. Finding a care home with trained staff and specialized services for dementia patients. When searching for a care home for a loved one with dementia, it is important to find one that has trained staff and specialized services for dementia patients. Dementia is a complex disease that requires specialized care and attention. Trained staff members have the knowledge and expertise to provide the best care possible for those with dementia. They are trained to recognize the unique needs of those with dementia, such as communication barriers and behavioral changes, and are equipped to handle them in a compassionate and effective manner. In addition to trained staff, specialized services for dementia patients are also important to consider when choosing a care home. These services can include memory care units, specialized therapies, and activities that are designed to engage and stimulate the cognitive abilities of those with dementia. Memory care units are designed to provide a safe and secure environment for those with dementia, while specialized therapies, such as music and art therapy, have been shown to be effective in reducing anxiety and improving mood in those with dementia. When touring care homes for a loved one with dementia, make sure to ask about the training and expertise of the staff, as well as the specialized services that are available for dementia patients. It is important to choose a care home that can provide the best care possible for your loved one with dementia, and finding a care home with trained staff and specialized services is a great way to ensure that they receive the care and attention they deserve. 5. Checking the safety and security features of a care home. When choosing a care home for a loved one with dementia, checking the safety and security features should be a top priority. This is because people with dementia are prone to wandering and may become disoriented and lost even in familiar surroundings. A good care home should have secure entrances and exits that are monitored electronically or by staff members. This ensures that residents cannot wander out of the care home unnoticed. Additionally, the care home should have sturdy locks on windows and doors, as well as a secure outdoor space where residents can safely spend time outside. It's also important to check if the care home has a system in place for monitoring residents' movements and whereabouts. Some care homes use wearable technology or personalized alarms that alert staff members if a resident strays beyond a certain area. Finally, staff training is a crucial aspect of ensuring the safety and security of residents with dementia. Caregivers should be trained in dementia care and be able to recognize signs of restlessness or agitation in residents, as well as know how to de-escalate such situations. In summary, checking the safety and security features of a care home is essential in ensuring the well-being and safety of a loved one with dementia. 6. Considering the location and accessibility of the care home. Location and accessibility are important factors to consider when choosing a care home for a loved one with dementia. You want to find a care home that is convenient for family and friends to visit, but also provides a peaceful and secure environment for your loved one. Consider the location in terms of transport links, such as bus routes or train stations. Is the care home easily accessible by car or public transport? You'll need to think about how often you'll be visiting and how you'll get there. It's also important to consider the surrounding area. Is the care home located in a quiet residential area or in a busy town center? Do the surroundings of the care home provide a safe and calming environment for your loved one? You want to make sure that the care home is located in a peaceful and tranquil setting, away from any stressful or overwhelming environments that could worsen their condition. In addition, you should consider the facilities available nearby, such as shops, pharmacies, and doctor's surgeries. It's important that your loved one has access to any necessary amenities and services in case of an emergency. Overall, the location and accessibility of a care home should be carefully considered to ensure that it provides a safe and peaceful environment for your loved one with dementia, while also being convenient for family and friends to visit. 7. Looking for amenities that will enhance your loved one's quality of life. When you're selecting a care home, it's important to ensure that the amenities available will enhance your loved one's quality of life. People with dementia require a lot of stimulation, and a care home that has plenty of activities, events, and social gatherings can be a great way to keep them engaged and improve their mental and emotional well-being. Some care homes may offer art classes or musical performances, for example, while others may have gardens or courtyards where residents can spend time in nature. For those who enjoy socializing, a care home with a busy events calendar can provide a great opportunity to socialize with others and make new friends. It's also important to consider practical amenities like meal services, laundry facilities, and housekeeping. These can all help to ensure that your loved one is comfortable and well cared for, and free to focus on the activities and events that they enjoy. When you're visiting care homes, it's a good idea to ask staff members about the amenities they offer and how they are incorporated into daily life. You can also ask to see a schedule of events or a menu for meal services to get a sense of the range of activities on offer. Ultimately, choosing a care home with amenities that suit your loved one's interests and needs can have a big impact on their overall quality of life. 8. The importance of visiting a care home before making a decision. When looking for a care home for a loved one with dementia, it's essential to visit any potential homes before making a decision. While online research and reviews are helpful, it's important to see the home in person and get a feel for the environment and the care provided. During your visit, pay attention to the atmosphere of the home. Does it feel welcoming and comfortable? Are the staff friendly and knowledgeable? Observe how the staff interacts with the residents and how they respond to their needs. It's important to ensure that the staff has experience in dealing with dementia care and are equipped to handle any challenges that may arise. Take a look at the facilities available and the living arrangements. Is the home clean and well maintained? Are the rooms and living spaces comfortable and accommodating? It's also important to consider the location of the home and the proximity to family and loved ones. During your visit, ask questions and voice any concerns you may have. Don't be afraid to ask about the care provided, the training and experience of the staff, and any other factors that are important to you and your loved one. By visiting potential care homes, you can make an informed decision and find a safe, comfortable, and supportive environment for your loved one with dementia. 9. Questions to ask when visiting a care home. When it comes to finding the best care home for your loved one with dementia, it's important to be prepared with a list of questions to ask when visiting. These questions will help you understand the level of care provided, the staff's qualifications, and the overall atmosphere of the care home. Some important questions to consider asking include: 1. What is the staff-to-resident ratio? 2. What type of training do staff members receive specifically for caring for residents with dementia? 3. How are residents with dementia specifically cared for? 4. What is the daily routine like for residents? 5. Are there any programs or activities specifically for residents with dementia? 6. How are medical needs, such as medication management or doctor's visits, handled? 7. Can you speak with current residents or their families to get their feedback on the care provided? 8. What is the protocol for handling emergencies? 9. Are there any additional services, such as physical therapy or occupational therapy, offered on site? 10. What is the cost, and what services are included in the cost? By asking these questions, you can gain a better understanding of the care home and determine if it's the right fit for your loved one with dementia. It's important to take your time and visit multiple care homes, ask questions, and take notes to compare and make the best decision for your loved one's care. 10. Conclusion: finding the right care home for your loved one with dementia. In conclusion, finding the right care home for your loved one with dementia is a crucial decision that requires thorough research, planning, and consideration. It is important to take the time to identify your loved one's needs, preferences, and personality traits to find a care home that is well suited to them. Remember to take into account the location, facilities, staff, and activities offered by the care home, as well as any additional services or support that may be necessary. Don't be afraid to ask questions and seek advice from experts, such as your GP, local authority, or Alzheimer's Society, to ensure that you make an informed decision. Once you have found the right care home, keep in regular contact with the staff and your loved one to ensure that they are receiving the best possible care and support. Remember to listen to their feedback and concerns, and work together with the care home to make any necessary adjustments or improvements. With the right care, support, and attention, your loved one with dementia can continue to live a fulfilling and enjoyable life in a safe and comfortable environment. In conclusion, choosing the best care home for a loved one with dementia requires careful thought and consideration. It's important to keep their needs and preferences in mind, as well as the reputation and quality of care offered by potential care homes. By following the tips we have provided in this article, you will be well equipped to make an informed decision and find a safe haven for your loved one. We hope this article has been helpful to you and wish you all the best in your search for the perfect care home.